Hi, I'm Leslie Gallagher. I'm the owner of Two Hands, Four Paws. I just gave a presentation about laser therapy in the field of rehabilitation, and I'm presenting a few case studies today. The next one we're going to talk about is a little yellow lab named Sophie. She came to us when she was a year old. She had pretty severe bilateral hip dysplasia. The right hip was completely subluxed, so it was a very, very painful hip, and she had osteoarthritis in that right. The left hip was not subluxed, did not have osteoarthritis, and so she had a triple pelvic osteotomy on the left side. Because the right hip was so advanced, they couldn't do the TPO on the right, so they had to wait till she was older to do a total hip replacement on that side. Her body condition score was a 6 out of 9, which was a little bit overweight. When you have a dog with orthopedic conditions, you really want their BCS to be about a 4.5 to 5. And she had very poor hip extension, so her right hip just would not extend normally. Her left was much better. This was a dog that was super frustrated because she was used to exercising a ton. She used to walk 20 to 30 minutes a couple times a day. So she was super frustrated that she'd been confined for a long time after her surgery, and she was only on tramadol, which is not effective at controlling pain. It really is just sedating. So when Sophie came to us, our plan was to start some weight loss. We put her on joint support. We started her on Adequan to support the cartilage in her joints. We stopped the tramadol because it wasn't working, and we added in a non-steroidal anti-inflammatory, which helped dramatically with her pain. So for the next 6 months, we did therapy twice a week, and we graduated her to fun swims when we could because she turned out to love the water. But she was still too young to laser her because her growth plates hadn't closed yet. So we did a lot of massage, we did range of motion, we put her in the underwater treadmill, and we sent her home with a home exercise program. But as soon as her growth plates closed, we were able to start the laser therapy, which is also super, super effective for pain. So for 3 years, she came here and did great. She swam, we lasered, we did massage, we did some acupuncture. And then obviously, as I said, when her growth plates closed, we were able to add in the laser. But then she started to get really uncomfortable with exercise and started crying when she was trying to get up. She had real difficulty rising, so she went back to the surgeon and had the total hip replacement on that right side. And then she came to us twice a week to recover from her surgery. And we also added in Gallagher, we added in Dasaquin. But the surgeon recommended no activity for 3 months and only sling walking her. So she was super frustrated that she couldn't walk, but we could put her in the water. And at the 6-month mark, we remeasured her thighs, and they were equal in circumference, which is fabulous. So Sophie came for weekly swim therapy for life, and she did phenomenally well.